Hi, I'm Molly from All Healthcare Careers. Today we're going to be discussing how to put on PPE. Before getting started, make sure if you have a jacket on to remove that, and if you have long hair, please make sure it's pulled back and out of the way. We're going to check the patient's order on the door to know what kind of PPE that we will need. Your patient could be on contact droplet, or airborne, just to name a few of the PPE contact orders. We know next we're going to do hand hygiene. 2 pumps of hand sanitizer. You are going to don all of your PPE outside of your patient's room before entering. First, we're going to start with a gown. Making sure to overlap the gown so that you're completely covered. And then also, you want to make sure to tie the gown, not knot it. That way, when you doff the gown, it will be easier. Next, we're going to put on our gloves. We're going to put our gloves on, tucking the cuff of the gown underneath your glove. This is going to help protect. And some gowns have the white cuff, which make it a little bit easier to get that cuff under. And then lastly, we're going to put on our mask. Pinching at the nose to make sure that your nose and mouth are protected. Once you have all of your PPE on, you're ready to enter your patient's room. After you've gone inside of your patient's room and performed whatever task that you needed to, you're going to doff, which means remove, all of your PPE inside of the patient's room. If for some reason you doff all of your PPE outside of your patient's room, you have now potentially exposed anything that could have been inside the patient's room to the outside population. So please note that you need to doff all of your PPE inside the patient's room. We're going to start with our gown first, okay? You're going to tug here where your ties are, and every gown will be different, and you're going to break, pull away like this, pulling down both arms like this, and again, away from the body, removing one glove, removing the other glove, and then rolling away like this, so that you have now completely removed your gown and your gloves without exposing anything to you. In the trash can. Next, I'm going to perform hand hygiene, 2 pumps of hand sanitizer, making sure to thoroughly rub for at least 20 seconds, the palms, backs, in between my fingers and nails of the hand sanitizer. Once that is dry, then I'm going to remove my mask and I'm going to place that also in the trash can. That way, I have now removed all of my PPE inside the patient's room, knowing that there was no exposure to myself or the outside population. Then you may exit your patient's room. We hope you found this video helpful. For additional resources, click the playlist for more CNA skills videos, or try our 3 free-day trial that contains over 1,000 practice questions to ensure your success on the first attempt.